Good afternoon, everyone. As ever on events to do with technology and digital, we're having a few digital technology issues, but I think we'll be there shortly. And thank you all for being here. This is part of a series of events being run by the Defence Data Research Centre, which is a collaboration between ourselves at University of Liverpool, University of Exeter, University of Surrey, Digital Catapult. I think that's everyone I've covered. We'll get going in a moment. Today, I think we've got some a kind of really interesting mix of things for you to listen to. The first bit is going to be an introduction from me that will be just about what we're doing in the centre and the focus for the kind of attitudes to data part of the project, which I am undertaking with Alex and Suzanne, who are on the call. Then I'm going to hand over to my fantastic colleagues from University of Liverpool and Civic Data Cooperative, who are going to talk to you about a very different approach to thinking about data and AI and the public's engagement with and attitudes to, because we work with the CDC colleagues on some of their projects, and it's a very different context than maybe the context we're facing with the DDRC, but it is still the same issues about rights, responsibilities, ownership, engagement, access, all these other issues. So Alex, if you can make the slides work, that would be great. And the second half of the talk today will be Alex and Suzanne talking to you about some of the things we've found talking to organisations about data and AI use. So thanks, Alex. There you go. You want to put it in presenter mode, and then.
Yeah. So fun update. I don't have PowerPoint on this computer. I'm using the Mac version. I'm not fully fluent with where it is because I tend to use my iPad to do this.
Right.
How do I do that? Play, possibly?
Yes, that's probably it.
Marvelous. Right.
Has that worked?
Yeah, strangely, it's now taken over both of my screens. Can you see it, everyone?
We can only see it in the whatever mode, but you'll just have to move it on, Alex. We'll live with technology failures today. Okay, so next slide, please, Alex. Where are we?
Can you see that?
No, it's not moving on, Alex.
See, I can see it on my screen.
Can you swap the screens or not? And if not, there we go. Right.
Let's just go back to the, yeah.
Click along. So just to tell you a little bit about the DDRC, if you don't already know, this is a research centre funded by DSTL. The goal is to think about, take an interdisciplinary look at the uses of data, particularly so that DSTL can understand about how data works in organisations. Obviously, DSTL works to the MOD and push that back into the MOD. But we've got everybody from computer scientists to social scientists in the team. And the idea is to take an interdisciplinary take on these issues. Next slide, Alex. We go to that next slide. So we've got 4 parts. We're looking at problem solving. So we've got a list of issues and things from DSTL to be addressing. We're also interested in fundamental research, but maybe closer to real world use than maybe theoretical computer science type work or kind of very theoretical social science work, research closer to actual use, helping to develop education and community type resources for organizations to use. And with all of that, so having some impact from our research work. So next slide, Alex. So there's these components to the project. There's 2 kind of vertical bits. We're looking after the attitudes to data part. The other parts are sort of case studies, data-driven healthcare, data-driven logistics, the challenges of managing data in organizations from an organizational management perspective, and then looking at technologies in context, the use of synthetic data as in data that, for instance, that where you need it to be highly anonymized or it's not easily shared, and so on. We're getting a message that some people can't see the slides. Is that everybody or just one person in the chat? Anyway, I will continue and we can, and then, okay. And then also cyber resilience and kind of data resilience in organizations. So the stuff we're going to talk about to you today is around our work around attitudes to data. So Alex, next slide, please. Why is this important? This isn't a technology-driven part of this project, and in fact, most of the DDRC is not technology-focused or driven. It's context, organizational, and usage-driven. If we're going to try and make organizations data and AI ready, we can't just look at the technologies. I mean, efficient, effective, ethical use of AI, data analytics are socio-technical problems. So that's our starting point for the attitudes to data element of DDRC. And just to put that in context about why the people element is really important. Some figures that might surprise you. 59% of the UK's working age population, so that's 3.9 million people, lack essential digital skills for the workplace. Yeah, so a lot of people in the workplace in the UK do not meet the government's core essential digital skills for work. And this does not mean high-end skills like coding. This is basic digital skills. We also know that 34% of households that have got children in them are led by adults who have got low digital skills or are limited digital users. That comes from our own research. And some prior research we did for Cisco, we found that digital leadership in SMEs is often missing. The core components of the kind of senior leadership teams in organizations, even actually large organizations, and we found this also in the arts sector back in sort of 2017, did some work there, lack clear digital leadership so that they can manage digital transformation in their organization. So one of the real barriers to better digital and data use, more ethical, more efficient, more effective data and AI use in organizations is the people component. So next slide, please, Alex. So what are we doing on the DDRC project? I'll just lay this out, then we'll move over onto our colleagues from the Civic Data Co-op in Liverpool to talk about what they're doing. And at the end, we'll feed you back some of our results from this first initial stage of our work. So Alex and Suzanne have run 44 workshops with people in organizations, different types of organizations, public, private sector, research, not research, around the issues they have around data use in their organization. They've used Lego Serious Play, which is a methodology where people essentially build the issues they're talking about in Lego as a way of eliciting actually a deeper understanding. We're just at the moment in the field with a 5,000 person UK workforce survey that will look at awareness, use and attitudes to AI and data analytics in the workplace to get a baseline of where the UK's actual workforce is at with these issues, and then acknowledge their awareness, their engagement. And we've also collated a whole set of secondary data sets that we brought together to help plan our survey, which include data on public attitudes to AI and data, which we're then going to do some further analysis on. As I said at the start, this is a DSTL funded project. So our next step will be to take those baselines and then go and have a look at the MOD's workforce and see where they sit in terms of their awareness, skills, attitudes, and so on. So next slide, please, Alex. Here's a picture just to give you a taste of what the Lego Serious Play workshops look like. You know, the kind of activities that people do. Leave that there as a as a taster for you that Alex and Suzanne will talk about later on. And next slide, please, Alex, which should be, oh, there you go. More on this, visualizing is more interesting. There you go. That's a quote from people doing this. And then this next one should be me introducing the CD. One more. I put too many Legos in. Oh, it's gone onto your data. Stop there, and we will move on to colleagues from the Civic Data Cooperative in Liverpool who'll talk to you about their approaches to attitudes to data and AI.
Thanks, Sim. So I'm just going to share my slides. So hopefully people can see that now.
Yeah, I can see that.
Yep, thumbs up. Great. Okay, so thanks, Sim, for the introduction, and thanks for having us here today. So my name's Ellie Fielding. I'm the Programme and Operations Manager at the Civic Data Cooperative based here in the Liverpool City region, and I'm joined by my colleague Rempel, who's the Public Engagement Manager for the CDC, and she'll talk you through some of the later slides. So I just wanted to set the scene to give a bit of context as to what is a civic data co-op and what do we do in the city region before we kind of drill into our work around AI. So we are a project funded by the City Region's Combined Authority, hosted by the University of Liverpool and specifically within the Institute of Population Health. We were funded right before the start of the pandemic, and I think as a lot of organisations had to flip quite quickly into pandemic response, which was actually quite helpful for us and for our origin story, because during the pandemic, health data became a central conversation that everyone was talking about. Our numbers and vaccine uptake and the COVID app, etc. So it was a interesting time to be working with health data. We want our kind of underlying mission is to make civic data from the region's people work for the people. So our COVID examples of that was that we were able to collect information from people's vaccine uptake and asymptomatic testing, and link them to ticket sales of gigs and business events that allowed the city to reopen our hospitality sector significantly earlier than other parts of the country. So that was our kind of live example of how we could connect these civic data sets during the pandemic, which sort of set the groundwork for what the CDC was then to become. So we, following kind of the close, if I can call it that, of the pandemic, we worked on kind of what that mission statement would mean for the broader work of the Civic Data Cooperative and how we could best serve the residents of the city region, whether that was members of the public, whether that was businesses, whether that was the research community, whether that was large industry partners. So we have three core areas of work that we undertake across the CDC, and I'll take you through each of these in turn. So the first piece of work that we do is around exploring what we can do with data and research. We have a technical team based within the CDC who help to create secure data environments or trusted research environments for a number of research projects which are hosted within the university, but working with partners, either academic partners or NHS partners across the city region and beyond. This allows routinely collected health data to be linked up from different sources so that clinicians and researchers can take their algorithms and their codes to those data sets to help them understand some of the challenges that are facing the city region. So There's just a summary of some of our projects that we work on there. So the Children Growing Up in Liverpool study is a birth cohort looking to recruit 10,000 children from the mother's 12-week scan and follow those children through to their 4th birthday, taking biological samples, but also data points along the way from surveys, etc., around mother's maternal health, for example, growth scans, etc. So the team has helped to build that secure data environment around that longitudinal birth cohort study. MRIC is a mental health project, Mental Health Research and Innovation Centre, and we're looking to bring mental health research and innovation closer to the communities that need it. And again, our team has created a trusted research environment for mental health data to keep that data secure, within the rights of the data controller, but to allow access for clinicians. All of this research takes place under our newly created Civic Health Innovation Labs, or CHIL, which the CDC is now part of, and this is an umbrella centre for all of these data into action projects, and the CDC kind of provides that underlying infrastructure to allow data access, but to also allow access to our communities and our business base, which I'll come on to. So as part of our technical infrastructure, we're also looking to create a digital commons, so an open space for sharing knowledge, data and insight for the city region. This is where we want to work with our civic partners to really open up data to provide the local community with the opportunity to interpret problems that they might be facing and sort of drive their own solutions. And this is where we're working with our public services across the region, so all 6 local authorities, police, fire service, ambulance service, NHS, to facilitate collaboration and coordinate how digital tech can be maximised to create more efficient and productive organisations and deliver better outcomes. So this is very much a project in development. We kicked off some work on Tuesday this week around what this might look like and what value it might add to the community. So very much a kind of a work in progress, but this is the vision of what we want to try and create for the city region. So we also work to imagine better services and solutions with data. So this is how we work with our local business base. So taking the approach of, so we spoke to a number of businesses and also a number of civic organisations right at the sort of start of the CDC's journey to understand how we could better support civic innovation around data. And we heard 2 very clear messages, one from our SME base saying we have so many great ideas, we just don't know how to get into public services to help them solve these challenges. It's really frustrating. And then on the other side, we heard from our public services that they've got so many challenges and so many ideas get thrown to them, but these ideas and solutions aren't really solving the really knotty challenges that they face. So that's where we developed What's Your Problem, which is a programme which offers a small amount of seed funding, but actually the greatest value is generated through opening up some conversations between our SMEs and our civic organisations around what challenges are they facing, get different perspectives on those challenges, collect different data points around what those might be, and then really help to support those SMEs and third sector organisations to innovate with impact and actually solve some of these challenges rather than solving problems that they think exist. So we've run 2 of these already. One was based on a number of challenge areas, and we focused last year into just looking at one challenge area, so that was mental health, and we've funded 5 companies through this programme to develop some research ideas and develop some sort of early stage thinking around potential new products and business concepts that could help solve some of these challenges. Our third piece of work is engaging community, and this really underpins the other 2 pieces of work and is kind of central to the ethos of the CDC. our kind of flagship project around this, and we've worked closely with Sim and his team on developing and running this program, took the question of what makes you well. So we recognise that there's a significant amount of data that is collected about communities out there, whether that's through the NHS, whether that's through the local authorities, whether it's sort of centralised ONS data. But is that actually what matters to the communities and the people that are living within those communities? Do those data points actually matter? So we went and spoke to we recruited 15 researchers from a community in Liverpool, so Widnes, and they went out and spoke to 200 friends, families, neighbours around that question. And a lot of the things you would expect came out of that. So, you know, what makes you well is around, you know, mental and physical well-being, access to green spaces. But there was also some interesting points that came out around community and sense of community and place and being proud of where you live. So the next phase of this programme is to allow this community and help this community to build a data hub to allow them to measure these points that really matter to them as a community, and then hopefully feed that back into the system. So yes, they might be you know, X% on the scale of deprivation and Y% on another scale, but actually as a community they feel that they're thriving, and these are the reasons. These are the ways you can measure that. So we're looking to develop that project further in the summer and take that methodology potentially into other areas of the city region or into other kind of thematic areas. That was a bit of a whistle stop as to the 3 areas of the CDC and who we are, just to give you a bit of a context and background. I'm going to pass to my colleague Em now, who's going to talk through a bit more of the work that we're doing around AI perceptions and how we're engaging with the community on how they want to use data. Em, over to you.
Thanks, Ellie. And if I start coughing and hacking very loudly, I will go on mute and then I will come back as quickly as possible. I have a cold right now. That's why I sound like a frog. So as Ellie mentioned, our core goal to make data about the city region work for the people who live here. In order to make data, quote unquote, work for an area, one of the first things you need to understand is what people think about data in their region and their perceptions and preferences around that. And more so than just understanding what they think, you have to create systems where what they think matters to policymakers, to local businesses, to different kinds of programs and projects. So Round Deer is an example of a research project on understanding what that different way of looking at governance and development can be, but we've also done some more traditional work on really just understanding perceptions and understanding of data, built on a lot of the work Sim has done as well. I'm sure he can speak to a lot of this in terms of perceptions of data and AI, but let's explore that a little bit in terms of some recent projects we've done. So we work closely with NHS Cheshire and Merseyside to look at public perceptions of the setup of their secure data environments. So if you don't know what these are, they are large-scale health data linkage platforms, essentially, that take a scrape of all GP records, as well as secondary care data and other social care data, and they link it together in an anonymous format. But you know, these things are not uncontroversial, and an important part of doing these kinds of big data linkage technology projects is understanding what people's expectations are around them. So we did a series of focus groups where we asked people from a range of different regions and a range of different backgrounds about what they thought about this kind of technology, a secure data environment. And we heard the kinds of things that you would expect to hear, and they're kind of consistent with what I've heard in the past decade of doing these kinds of focus groups and studies around perceptions and attitudes to data and AI. The first one is that there's generally, when you talk about something embedded in an NHS context, there's broad support for health data sharing in that realm, and including health data sharing without explicit individual consent for each project that wants to link data up. And what this represents is when you ask people, do you trust a secure data environment that is housed within the NHS, what they're really telling you is whether or not they trust the NHS. And so data is reflecting back that trust that people have in the health system. So I think an important point to make about this is, though, a lot of people will say, yeah, I'm very comfortable with health data sharing if there's a clear public benefit and I understand and it's transparent. That's really embedded in who's asking the question. Second is the importance of communication. And this seems very obvious, but a lot of data technologies, particularly around AI, are still very much misunderstood, and there's a big literacy gaps in understanding what data is and how it's used in our society. So if people want to, quote unquote, accept a technology or support it, you need to do some very embedded on the ground communication about what those things are and what they mean for people. Third, anonymization or de-identification, wherever your process lies along that realm, is very important to people when they talk about health data sharing. And what this reflects on larger narratives is that not all data is the same. So when you talk about saying, oh, most people are comfortable with data sharing, once you dig down and say, what about data about gender? What about data about diagnoses? Those perceptions vary a lot more. Fourth, and this is where the AI conversation comes in, public and patients want to see recognition and communication on general data concerns. And Ellie, if you go to the next slide, I have some quotes from the focus groups about this. So when you talk to people about what do you think about a secure data environment, one, you have to spend a lot of time explaining what a secure data environment is, because it's not something that's evidently very clear and easy to understand. What we heard back after doing some education exercises with our participants is that they still wanted to talk about the broader issues of data. So, you know, I may be going to them and saying, we're building a secure data environment. Is that okay? How would you like it to be used? But what they really wanted to talk about is the larger scale of how data fits into their day-to-day lives and society. And they wanted recognition that these kinds of data technologies do not happen in silos, even if that is how the system would like you to perceive them. So quite spontaneously, a lot of people started talking about artificial intelligence and AI and how they thought about that from data. And a lot of the conversations, as you can imagine, because again, there is not a lot of literacy around what AI is, were based in fear and concern. So one person said, I think it'll become more important with artificial intelligence, and I'm not sure whether any humans can be involved, and whether that's a risk to us all, or whether it's essentially, I don't know really, that's what I'm thinking about for the future. So what they were reflecting on is this unknown, that sure, they would like to see their data used for public benefit, for health research, but once you put in a system that they don't understand, that's not transparent and easy to understand, they have a sense of fear and concern. And the person below, and this is quite dramatic, but you know, they recognize that, say, their concern was that the use of data in controlling populations, and they said, I'm talking big picture now. At the end of the day, some people have a real fear that data can be used as a control of the population politically as well. So again, we had a really focused conversation about one specific kind of data linkage technology, but what people bring into that is their perceptions and fears around AI. And the most common thing you're going to hear right now is that I don't understand it super well. Is it going to control my life? And I'm concerned about it because it's new and it's emerging. So it's a very important time to be having conversations about AI perceptions, which brings us to our next slide, Ellie. Rather than hear me blather about it, and I hope it works, and if it doesn't work, I will just say what people said. The sound. No, I can't hear the sound. Can anyone hear the sound? No. That's okay. I will talk to it quickly with an eye on time. So we did a series of interviews and then thematically analyzed those interviews with people in the Liverpool city region to understand what their top concerns about AI was. And what we didn't do, like we would normally do, like the secure data environment focus groups, is we didn't spend a lot of time going over education around AI. We spent a short time giving them some 3 basic pointers about what we mean when we say AI. And then we let them just talk about what that phrase meant to them, how they understood it, what their concerns were. And what we heard back from people is very similar to what we heard in those focus groups, which is, I don't quite know what it does, but if it does have an influence on society, I would like to have a say on what that influence is and where it's applied. The second big thing was a conversation you're going to hear a lot about, which is concern around jobs and the way that AI is going to change the nature of work. And then the third one, which holds out in a lot of research, was around the desire for AI to be leveraged to improve healthcare, which goes nicely to my next slide. And we will link the video if you're interested in watching it, because I think it's really interesting to hear people talk about AI in this sort of embedded regional context. So we filmed this video, and then I did a very quick scoping review of current understanding and concerns around AI in general at a national UK level. And we held an event called the Big AI Debate last month, and I can put a link again to a summary of that event. But I synthesized like 4 core issues to ask a panel of experts about in terms of the public involvement and perceptions of AI. The first one was an obvious one, which is public understanding of the impact of AI. A lot of the conversations around AI are focused on existential risk. You know, the Matrix, the robots are coming in 30 years. We're all going to be under the control of some unknown, uncontrollable force. And as much as that, you know, for some people is a concern, I suppose, what that really does is it masks the real impact right now of automated decision-making and AI technologies that can impact people, which goes to question number 2, which is what are those issues right now around social inequities and harms from AI that we should be thinking about. One of the points I bring up, and you can read about it in the links that Ellie is putting, is that a lot of AI systems, they reflect existing social justice harms. So racism, sexism, ageism. If you have a system that is going to create data that reflects those harms, then you're going to have an AI system learning to reinforce those harms. So even though most people are going to talk about these existential risks around AI, those embedded day-to-day lived realities of how automated decision-making can harm people need to be talked about now. But it wasn't all, you know, fears and risks around the conversation. There's some really excellent work being done by the Ada Lovelace Institute on mapping out public preferences for the use and application of AI. And rather than asking people generically, what do you think about AI? Where do you think it should be used? They talk really specifically about a set of core AI technologies and how those can be leveraged in different industries. So if you look at their survey work from last year, the number one preference for where AI should be applied is healthcare. Again, which aligned very closely with the interviews we did with residents from the video. But if you look at a mapping from UK national government about industrial spread of where AI is applied, you'll see that communication technologies are the number one place where AI is currently in use, which is obvious when you see things like ChatGPT and Google and all these leveraging AI technologies. So that represents kind of a fundamental separation between where people want to see AI research being done and where it's actually being done. So there's another issue there in terms of perceptions of AI and where there's a mismatch. And the fourth, which is where we take a big, huge round circle back to the idea of public participation and deliberation in AI. So last year, during the AI Safety Summit, which focused very strongly on existential risks around AI, there was a series of events called AI Fringe, as well as a series called Connected by Data's People's Panel on AI. And they set several recommendations for how they think the different public groups and community groups should be engaged in the use of AI. And I encourage you to have a look. I'll put the link up again about the findings from that work, which were really around how we create systemic and sustainable governance structures so that some of these issues and these questions I've been raising about public perceptions and understanding of AI can be better reflected in the research and the technologies that AI are applied within. Which is, again, something that we are doing at the Civic Data Cooperative. We want to create and test and research systems to make what people think about data and AI matter rather than just research what they think and then not have a clear aligned impact. I'm not going to say we've been successful on that yet. It's definitely a research in progress, but that we're very passionate about achieving. And I will end there. Thanks.
So huge thanks, Emily and Eleanor, for that and for that intro. And highlighting lots of, I'm the one coughing now, highlighting all of the same kind of issues that we're maybe encountering in our domain that we're working in a different domain, health, civic engagement. We've got about 5 minutes for questions for you guys before we shift back onto what we've been doing with our Lego workshops. So does anybody have any questions? Either try raising your hand or put it in the chat and I'll read it out to colleagues here. Not seeing any hands popping out. Right. So it says, Emily, you mentioned the AI fringe and something else that are good sources of AI information. What are they again?
I'll put it in. It's connected by data in the people's panel. I'll get the link right now.
Thank you. Do we have any other questions? Because I will abuse chair's privilege if people don't. Oh, there's one there. I'm going to have to find where the... so, Glenn. Can we hear you, Glenn?
You might be able to hear me now.
We can hear you now. Yes, there we go, Glenn.
My microphone
Cheers.
was up. Classic problem. Yeah, thanks for the that talk on that. It was really interesting. I was wondering, you focused very much on healthcare, and you sort of mentioned there that you felt that I think people were possibly more easily supportive of that. I mean, do you have any sort of evidence for that, or is that just sort of gut feel? And do you think then you'll get different responses if you then sort of seek out into other organisations with different priorities?
So I can link to the ADA study that I mentioned. Sim's linked to the Ada Lovelace Institute in there, and so they did a massive UK-wide ranking study looking at like different industries, and healthcare came out as #1 consistently across every community group in terms of being more supportive of the use of things like AI and data technologies. And that is underpinned by like decades. I think health was very early on in those conversations around what do people think about us sharing data. And so there's a lot of existing, especially really, really rich qualitative research done on the expectation that health data sharing is a little bit of an exception, I would say, rather than the rule in terms of how comfortable people feel about that being something that could have public benefit. So definitely not a hunch. Is there anything else? I can offer some links in there too if you're interested in doing some further reading.
Thanks. Yeah, if you put some links in, that'll be good.
Okay. Artie, you've got your hand up. I hope I've got your name right.
Hi there.
Hi.
Yeah, that's correct. Can you hear me?
Yes.
Okay, great. Yeah, thank you so much for the talk. So I had 2 questions. So again, for Emily, so or I guess the panel in general. So like, what are key specific ways in which AI is being leveraged right now in the health sector, and current challenges that currently exist that you might know that currently research is being done on how AI can be used to leverage, or how AI is being leveraged to try and solve those?
So that's a very big question.
Yeah, sorry.
That's okay. Panel to comment on this as well. Interesting. I will just comment on the interesting work I've seen lately. I think retinal scanning is an area, ironically, where there's been a lot of leveraging of AI research to try and automate and improve that. So diagnostic imaging is a big area where the NHS as well as other universities have been supportive of. As Ellie just put a link to, I'm forgetting a project from our own research team around prescribing data and creating better systems to highlight when prescriptions go wrong. And just to be a little cheeky, my most passionate area of where AI is being applied, and I think is amazing, is in the management of type 1 diabetes. So I have type 1 diabetes, and there are several new AI-based technologies, not super fancy AI, but around how you take blood sugar data and create essentially an artificial external pancreas for people who have type 1 diabetes and then apply that. So I think there's a lot of really positive stories. What I would say is that a lot of them are not based on currently enacted work is how I would phrase that. And so a lot of its potential, I think retinal scanning is a good example of that. People talk all about how it's amazing and this is going to improve diagnostic measures and lower eye cancer rates and all that kind of thing. But like, it's all hypothetical right now because these technologies take so much time and money to build. Yeah.
And I think to add just quickly to that, the AI systems that are being developed and researched can only be as good as the data that they are trained on. And I think, you know, we recognise a lot in the work that we do, and Em touched on it in her presentation, that there's gaps in the data that the healthcare system has, and it relies on people coming forward and using the NHS. And if the data is not collected in the same way or categorised in the same way, etc., these AI systems can miss people out, and you know, for minority groups across the regions that we're doing these research on, there's less information about them. So I think there's all those things to be considered. It's great to be thinking about how AI can help within healthcare, but we've got to get the data right first. Otherwise, we're training it to answer the wrong questions.
Thank you.
Thank you so much. And I had one more question. So you mentioned this, Eleanor. Wait, let me find the question where it's gone. Yeah, so you mentioned that with the What's Your Problem campaign, you provided some seed funding to kind of companies. So I guess I wanted to hear more about like specific examples of kind of the key problems that companies were trying to implement, that with the seed funding then they managed to implement.
Yeah, of course. So our first program, we focused on a couple of challenges. So one was around how do we prevent children going into care, and the other one was around how can we help public services become more digital. So we gave out funding to two companies there. One was around a company had been thinking about doing this for a while, but they wanted to speak to their families who were known to them, so they were already in the system, and understand why they hadn't reached out for help sooner, and you know, what were the barriers to asking for help, what were the perceptions of what that help might mean. So we gave them some funding to go away and do an initial feasibility study, working with a cohort of families to understand kind of what those challenges were, and then to adapt their service provision to meet the needs of those families, and to kind of spread the learning that they'd done across the city region. The other company that we worked with were looking to code health data better. So they're a company that works with a number of GP practices across the city region to help simplify their website updating process. So they wanted to be able to code central NHS information both by topic and by geography, so that if the NHS centrally pushes out some information, every GP practice within the city region that they work with, their website will automatically update with the latest guidance on this particular condition or this particular campaign or whatever it might be. So they were going back through all of their data and kind of recoding. So they needed funding to kind of fund that 3-month project to understand that. They've gone on subsequently to achieve quite a significant amount of additional funding through SBRI around using those methods of coding of metadata to build better maternity advice that is both culturally relevant and obviously interpreted from a linguistic perspective as well. So that was in the first round. And then the second round of funding, when we were looking at mental health conditions, we funded two companies. One was around how you could create better communities around live events, recognizing that often people don't have don't have networks, so how can they go out and meet people? So they built an app And then the other company provides mental health training for institutions, organisations across the city region. They wanted to learn more about the people that are using their training services. So they are building a large language model to help them understand around some of the queries that are being asked so that they can adapt their services better, but then also feedback to the organisations who use their services and more broadly to the sort of public health system of the city region to understand what questions and challenges are being asked. So it's a real like broad spectrum of companies. Yeah, like they all have data at the centre, but then they're all looking to solve these kind of challenges that are facing the city region. So I hope that gives a bit of a flavour as to who we funded and for what.
Yeah, thank you so much. I think sometimes it's a bit hard to understand like exactly the problems, and sometimes you can talk about overarching topics and without like understanding the key concepts or like the key problems. So it was a very helpful answer.
Thank you. Right, I'm very conscious of time, because as ever with interesting conversations and interesting presentations, everything drifts on a bit. I'm going to challenge my team to do their 2 presentations in about 4 minutes each. These are really early results from the workshops we ran, the Lego workshops. I skipped on too many slides and showed you the pictures of the workshops. There we are. Here are the pictures of the workshops of people building their issues and challenges with using data in different types of organizations. So I will hand over, I believe, to Suzanne to go first, to talk about some of the language that was used, and then Alex to talk about some of the themes we found. This data is not yet fully analysed. We are in the early stages. Go.
Thank you, Simeon. The first thing was a confirmation that our workshop accomplished the objectives, that we got people to talk about data, and using a software called Sketch Engine and their corporate comparison tool, looked at 11.5 million words of British spoken English and compared it to our workshop transcripts. And these were the top 25 content words that differed from the BNC spoken corpus. So it was a confirmation that, yes, we did get people to talk about data. And then I used a software package called W Matrix out of University of Lancaster, and every word in a data set is tagged for its semantic meaning, and it's based upon these 21 top-level domains. So every word is assigned one of these domains, but below these domains are subcategories to the point that there's over 400 subcategories. So this isn't a sentiment analysis; it's more of a what emotive categories of words, what were the high frequency words, but really what's the story around these words. So the top most frequent emotive word categories were worry, angry, and confident, and listed there are some of the top words in those categories. Now we'll look at what the story is behind them. So for worry, over on the left, we have mostly worries about data. And then we get into some organizational worries. Hybrid working was something we heard a lot about in our workshops from many different aspects, mental health, technology, accessibility to data, who's in the office. The nonprofit, we divided our workshops into 6 sectors, and the nonprofit sector was the most worried, so to speak, about these concepts, with universities being the least. Alex, or yeah, angry. The consultants were the angriest. We won't get into exactly what companies those were, but the word surrounding angry had to do with a lot of it with the data integrity. Is the data I'm using accurate? Is it consistent? Can I access the data? And then we get into some organizational issues, internal processes and procedures, and Alex will speak about that as well. Employee incompetence. And then on the right-hand side of that list is the technological things that people are worried about. And it's interesting, Emily mentioned the unknown, and that was something that people actually spoke about. They were angry about the unknown when it came to technology. And then confidence on a bit of a more positive one, although a lot of times confidence was negated. So the word was negated with not in front of it or something, but it still helps us create a picture And in this one, the universities were the most confident. So the universities were the least worried, the least angry, and the most confident. But the universities that we interviewed, they're insured, and they have a lot of restrictions on regulations and use of data and so on, as you can well imagine. So there was more confidence in their language surrounding data. And on the left-hand side, issues that they're confident with data, but then you also get into organizational topics such as intra-team abilities. And then on the right-hand side are the technology that they're confident in, as well as some other organizational issues. Thank you, Alex. And then we looked at a category called positive evaluation, and these were the top words in order of frequency. So trustworthy, good, great, better. Again, these words were often negated. So we had it's not ideal, it's not perfect. But from those stories, we were able to create an image of what really kind of an ideal environment surrounding data. And the words were distributed almost equally among sectors. So that, again, was a confirmation that we were getting people to talk about these issues. And there were a lot of similarities. So on the top of the positive evaluation was, and the darker blue color is technology. And then below it in green is about data. And these were the things that they wanted, or they felt were good, or they wanted to be good. And on the right-hand side, we get a lot of the organizational. And so when it comes to this positive evaluation, again, it could have been negated, but these are the things organizationally that people need to have to do their job when it comes to working with technology and data. So a lot of great recommendations, really. And one more slide. Another high frequency theme was obligation or necessity, need, necessary, essential, and must. And again, these words were sometimes negated, so we had to look at them and say, what are they talking about? And a lot of it is organizational, as it has been in the other ones. So people wanted project expectations. They wanted to use best standards and practices. A little bit about data. We didn't see much about documentation in the other language analysis of the emotive words, but documentation, confidence, and legacy system. So looking at these words, we pulled some additional information out. Again, and the focus a lot is on the employee and the organization and what they would like in a ideal environment. Very little about technology. I think it's fair to say that there is trust in the technology, and their issues surrounding data have more to do with an organization and their workplace. And I think these last two slides could almost create the ideal environment, just looking at the language of what was positive about their work, but what they wished was different about their work. Thank you, Alex.
Okay, thank you very much, Suzanne. I'll be as quick as I can with this because I've got an eye on the clock as well, and I'm mindful that it is kind of a spiritual Friday today, if not an actual one, because we're all looking forward to the weekend. So very briefly, I'm going to talk about some of the results in terms of our coding. So when we conducted these Lego workshops, they're 90 minutes long, and the most substantive part of the workshop is a shared task that individuals do, usually as groups of 3 or 4, but there were some variances between different workshops, and they then present what they have built and explain it. We then captured that, we recorded it, we've transcribed it, and then we've gone ahead and coded and analyzed it, and these are just some of our findings so far. So from our qualitative coding, we're using a program called Atlas TI to do this. These are the 10 most common codes that we have come across. So you can see the most common code was people discussing processes, policies, or practices, which is possibly to be expected because this was the central point of our exercise. We're talking about data use in organizations. Then after that, we have issues around accessibility of data, data security, themes relating to the organization itself, risks, technologies, application systems, data integrity, ownership, and storage. So what do we then do with those 10 codes? We have done some co-occurrence. So if you look at the darker colors, these are the most common co-occurrences. So what this does, it illustrates how often those 10 key themes from the last slide were discussed in relation to one another. So organizational issues often linked to processes. Again, that may be quite expected. We have issues of accessibility and data security, quite commonly mentioned alongside one another. People talking about the balance of being able to access data, but then security processes sometimes hinder that access. We also have issues around accessibility and working processes and policies within an organization. And sometimes, and this is how these kind of chime with each other, because as Suzanne pointed out, you get things like frustration, and those may be in relation to some of those things. And again, this is tentative analysis right now. What's also to probably be expected, people talk about data security and risks commonly in tandem, and so on and so forth. So from there, we expect to kind of pull apart some of these common co-occurrences and do a bit further analysis. I also have a couple of nice visualizations for us to look at. So this is a Sankey diagram. This again just kind of shows the flow of those co-occurrences. So you can kind of see the big thick bars being the most common. So we can see processes and organizational. It's a big thick one here. What it kind of also does speak to is just kind of the complexity of what people spoke about. And Suzanne obviously said, you know, it kind of validates our approach somewhat, this kind of from the more qualitative end of things. People are talking about incredibly complex phenomena. Data is a complex thing within the workplace, and yet we've got people to play about Lego and talk about some very serious issues. There's also this one, which is our codes just purely relating to data. And what strikes me with that is just the sheer complexity and the amount of different data flows going on here, apart from the kind of evil face that I can kind of see in the middle of it, which is slightly creepy. But I can't decide if I think it's an alien or a chihuahua. But what this does kind of demonstrate, silly faces aside, is the complexity of these different issues and how they all relate to one another. Finally, and again, mindful of time, it's just a quick word cloud we put together between some of the common groups. So this one is discussing the issue of accessibility and security and that balance between those two things that people commonly spoke about. So data, central to all discussion. Again, that's some of the framing of our workshop. But one thing that strikes me particularly, and this kind of goes throughout all of our different co-occurrences, is the discussion around people and things. So really that this is socio-technical research. So people were very concerned, not just about data, but with the people using it and also the things. So that might be things like connected devices, computers, laptops, and the relationship between those. But yeah, bang on 1 o'clock. I will stop speaking there. And I think we possibly have time for some questions, but I will pass back to Sim for that.
So we are technically out of time, but we can hold on for a few more minutes. If anyone's got any quick questions on our findings, if not, we'll leave our contact details with you. We'll be sharing the slides and things, and do get in contact with us if you've got any further questions. So does anyone have any questions before we wrap up, as Alex said, on a virtual Friday? I'm not seeing any questions appear in the chat or any hands popping up. I'm going to take that as everybody needs to go for coffee. I'm sorry we kind of hit the barrier on time. You know, the DDRC research is fresh off the farm, whatever. It's fresh and new. We've only just started analysing that. It was great to hear from Emily and Eleanor about the CDC work. I think a different perspective that takes a citizen and a user perspective on data and kind of returns the telescope round, etc., is just really important in this space, no matter which domain you're working in. But it's also nice to see, and I think it showed from both sets of presentations, that the same issues come up whether you're working in one domain or another, as organizations and people try and address this new kind of datafied AI world. We will obviously be updating more on things that we're doing on the projects. There will be some blogs this month from our part of the team, which of course you can find on the DDRC website. And do keep following the website for updates and news on things we do next. But finally, a huge thank you to Emily and Eleanor and Alex and Suzanne for presenting today. Thanks a lot, guys. Cheers.